Well, hello, Gold participants, and we're glad that you're able to be with us here today. Welcome to the Gold Perinatal Online Conference for 2014. I'm Fiona Lang-Sharp, Public Relations Coordinator and MC for Gold Perinatal Online. Thanks, Susan, for being with us here today. As you know, you're one of our presenters at our conference, and we're going to be talking about your topic, your presentation that you're presenting. It's called How Healthcare Providers Might Use Growth Charts as an Education Tool. Thanks for being with us, Susan.
Oh, you're welcome, Fiona. It's a great pleasure to be here today.
So I have some questions for you today about your presentation, and I'm going to get started right away because I know that you've got a lot to tell us about it. So what impact do you believe growth charts have had on our families in the past?
Well, if I think about the developing areas where I work for many, many years, I think that the use of growth charts enabled healthcare practitioners to recognize that infants were not necessarily normally smaller than infants in other areas of the world, but many of the problems, many of the growth patterns were actually due to malnutrition, and it was having a tremendous impact on future health. So it really created an awareness that malnutrition was a very big problem in many of the developing areas. In terms of the developed areas where I now work in New York City, I think that we have not really reached our full potential for understanding how to use growth charts. What I see in the area that I work in is that growth charts are often interpreted in ways that either cause false alarms, where parents are deeply concerned when their baby actually is doing okay, or false reassurances where babies are starting to slip in their growth and they're being told that their babies are okay. So I think there's room for improvement in many areas with the use of growth charts.
Excellent. Well, I couldn't agree more with you, Susan. I know for some families, it can be quite depleting, in when that growth chart becomes so unnerving when it's not used appropriately. But I want you to tell me a little bit more about how you first became interested in this topic and why you wrote about it.
Well, I first became interested because I was hired for the summers to train Peace Corps volunteers in nutrition in Niger immediately post-famine, and they were using growth charts there. And so much of the training surrounded teaching these volunteers how to use the growth charts, and they were using them to determine what kind of health education and how to supplement the babies that were not doing well there. And I have to say, in that environment, so much emphasis was put on the growth charts that it was really detracting from the health education that was going on. So in that setting, I found that the growth charts were pretty much an abysmal fail, that they would have been better off actually just doing the education.
Excellent. Yeah, go ahead.
And so I became interested in how you would use those in a better way and more appropriately.
Of course, and that totally makes sense. So lastly, Susan, what would you like our listening audience to learn about growth charts as an education tool?
What I really want them to come away with is the idea that they can be used strategically for specific problems, and that they should always be used in a way to empower parents to either make the changes that are needed to enhance their baby's growth and feel proud and about making those changes and seeing that it's influencing their baby's growth, and also to use the growth charts in ways that are reassuring when parents are concerned that their baby isn't growing well and their baby actually is growing quite fine.
Well, that's great. Thank you, Susan. I'm very excited to hear more about this topic, as I'm sure our listening audience is today. And I surely appreciate you being able to sit down with me today as well. Well, thank you for your time, and thanks for everyone listening. Again, Susan will be presenting on how health care providers might use growth charts as an educational tool. Thanks again, Susan, for being with us, and thank you again for listening. Have a great day, everyone.